Well, Texas is now the first state in the nation to reach 1 million COVID cases and 8% of El Paso's population. 8% of that city's population is now infected with COVID-19. There are now 10 mobile morgues on the ground in El Paso alone, as deaths are also spiking there. And now a county judge is strongly considering extending a 2-week shutdown that is set to expire today. With me now is Dr. Ogochika Alozie, an infectious disease expert and a member of Texas's Medical Association's COVID task force. It's good to have you. I'm sorry it's on such dire news, but thank you for being here.
Thank you.
You have said, look, you've got these 26,000 active cases, over 1,000 people in the hospital in El Paso. You call these dark times. Is there any choice in your mind but to extend the stay-at-home order, the lockdown, for more weeks?
Yeah, I think so. First of all, thanks for having me. And these are dark times, but I do want to also relay a message of hope. That as the community sort of focuses, reduces their mobility, and we get a hold of this crisis, I mean, we have the resources amongst the healthcare system here. I think that's what gets us through the winter and into next year, where we can start to talk about the vaccines and the therapeutics, the antibodies. And so hopefully the community will rally around like we did after August 3rd last year and really form the nexus of what should be El Paso Strong.
You know what it's like for the healthcare providers on the ground, because you're there and you're working in these hospitals every single day. And you've talked about physicians and nurses literally coming up to you crying. What are they going through?
I think the biggest word is just fatigue. And there's some frustration. I mean, the fact that we are here isn't where anybody wanted to be when we went through our initial surge back in July and August. And that sort of constant wear and tear of seeing people come in sick and intubated. But again, in as much as we have those messages of the patient that took his last sip of Sprite battling this disease, there are also those messages of family members that have survived, that have come through and been able to go home with their families. And I really want people to focus on that to give us our North Star going forward to get through this.
A nurse from El Paso, where you are, was dispatched to New York in the spring when we were going through, and we were the hotspot, and we were experiencing the worst of this. And he came back and he told our affiliate that what El Paso is going through now, in his mind, is, quote, rougher than the time he spent in New York in the spring. Is it that dire at this point in time? Obviously, you have better therapeutics, so more people are living instead of dying as they were in the spring. But still, is that an apt comparison?
So I wasn't in New York, but I think one of the things that people don't realize when they think about El Paso is that for a city of almost 1 million on the border, we probably have less healthcare resources than a lot of large cities, right? New York is the mecca of healthcare in the United States. And so we have struggled with physician shortages, nursing shortages, but through the governor's help, through FEMA, DOD, we're getting those resources to really get our hands around what's going on right now. And again, that's why I speak to our community to say those resources are here right now. As our country continues to go up 45 over 50 states, increasing in their infectivity rate, they won't be here forever. And so we really need to focus in and get this done for our community.
Well, Dr. Ogochika Alozie, thank you very, very much for what you're doing on the ground and for projecting that hope as well. We need that right now.
Thank you, Poppy.